Okay, so we had a little technical difficulties. Had to change the material setup just a little bit. Um, Basically, the wrong syringe tip was on the syringe, and so that didn't allow the adhesive to express out of the syringe properly. So we switched that up. The lesson of that is just make sure that you're using the right equipment. And so now, like I said, we're going to just express a little bit out of the syringe tip onto the glove so that we know that we're ready to go straight to the tooth. Okay, we're good to go there. Now, from here, we're going to start with the lower left canine. Open as wide as you can for me. And we're going to start by adding the adhesive on the lingual aspect of the wire. I have the syringe tip touching the enamel, and then I go up over to the incisal aspect of the wire, and then I go right over the wire. So I've basically made 3 stripes. I've gone gingival, incisal, and then right over the wire. And the whole time I'm making sure to touch the syringe tip to the enamel to make sure that we don't create any voids or discrepancies in the fill of the placement of the adhesive. Okay, so the lower right canine, the wire in the lower right canine is kind of off a little bit, so I'm gonna cure this lower left one so that way it stabilizes the whole wire, and then I'll go back to the lower right. Oftentimes I'll bond both the left and the right canines first, cure them both first, and then go back and cure the rest of the lower incisors. So the lower left canine is set. So now it just required a little adjustment there. I just positioned, open wide for everybody. I just positioned that wire so it was laying flush with the surface of the enamel. And now we're going to go back and we're going to use the same process. We're going to start lingual to the wire, or gingival to the wire rather. Then we're going to go up and around so that we're incisal to the wire. And then we're going to come back and go right over the wire. Okay, so again, it's a 3-step process, and the goal is to create a nice, fluid, complete coverage of adhesive without any voids. As long as it's smooth, then it's comfortable to the patient. When it's comfortable to the patient, the longer it will last, the better they'll take care of it, which means the better job it's going to do from a retention standpoint. I should say the better it's going to do its job. Okay, so now we've got it stabilized. At this point, you don't have to worry about the wire moving at all because it's fixed on those 2 lower canines. Now it's just a matter of adding it to the rest of the incisors. Open a little bit more for me. This is an interesting case because this patient is missing a lower incisor. So typically we would be bonding this to 6 total teeth, but in this case we're only bonding it to 5. However, it really doesn't change the process much. It's just 1 less tooth to bond. So again, I started on the gingival aspect, then I went up to the incisal aspect, and then I went over the wire. I did that twice just to make sure that I had enough thickness of the material. Okay, again, gingival, incisal, right over the wire. One thing that I didn't specifically verbalize is the purpose, not the purpose, but when you add that 3rd stripe, you go gingival, and then you go incisal with the adhesive, and then you add that 3rd stripe right over the wire. This adhesive has capillary action as well, which basically allows the adhesive to flow from the gingival to the incisal. In other words, when we add the 2 layers above and below the wire, and then we add the 3rd layer right over the wire, the material will kind of flow all by itself and connect the 2 stripes that you already placed. So thus, it creates a nice kind of seamless, smooth application of the adhesive. So as I'm looking at it now, it looks like the adhesive that was applied is very minimal. That's what we want, but I also want to check to make sure that number 1, so right here when I look at the lower right canine, I can get a little catch with my scaler. I don't want that catch there. I want a nice smooth transition of adhesive. When I go from, the catch is on the gingival aspect. When I go from the incisal aspect, It's a nice smooth contour from the enamel to the adhesive to over the wire. But when I go on the gingival, there's a catch. That would be a plaque trap, so we're gonna add adhesive right there to make sure it's smooth. So I'm gonna check for that on all 5 of the teeth where the wire is bonded. I'm also looking to see if there's any rough areas or any areas that jut out from the adhesive. And my goal is, what I'm hoping to see on each one is, for example, if you can see how this scaler is moving, it just goes smoothly from tooth to adhesive to tooth. That's exactly what we want. That's going to be the most comfortable for the patient. So far, we're good to go everywhere except for that lower right canine. Everything else is nice and smooth, okay? Before I add that material, let's just point out something else. Number 1, you can see we didn't get anywhere near the gum line on any of the teeth, okay? Number 2, we also didn't get anywhere near the contacts. So there isn't any adhesive in between the contacts, so the patient's going to be able to floss in between the teeth just fine. There's a little bit of calculus that's still here, it looks like. So when he gets his cleaning, they'll be able to remove that. Also, we didn't talk about placement of the wire much. That's because you can refer to the guidebook for a figure to describe placement, but briefly, just like we don't want the adhesive close to the gum tissue, we also don't want the wire close to the gum tissue. We want the patient to be able to floss properly. If they can't floss properly, this retainer isn't going to do much good because it's never going to last. So we keep the wire as far away from the gum tissue as we can without the wire going vertically above the embrasures in between the teeth. We don't want anybody to be able to see the wire in between the teeth from the facial. So you can see that the wire is basically right at the level of the contacts, just below the embrasures, and a good distance away from the gingival surfaces. So this is going to be a good fixed retainer that should last him a long time. It's going to be very low profile, so he's not going to feel like he has something in his mouth, not something really big. A lot of times when you see fixed retainers, they're really big and bulky, and there's lots of adhesive, and that can be annoying to patients. And also, it's going to be very hygienic because it's low profile and because of its positioning of the wire and the application of the adhesive. So all of these are important in terms of the quality of the fixed retainer and in terms of the longevity of the fixed retainer, how well it will last and how good of a job it will do. Okay, so I'll just cure everything one more time, make sure that it's set, and we should be good to go. So from here, you can instruct your patient on how to floss that retainer, how to take care of it, let them get used to the way that it feels, and you're good to go.